On behalf of the Government of Canada, our most sincere condolences to the family and friends of Captain Casey from the Canadian Forces Snowbirds. We also hope that Captain McDougall recovers swiftly from his injuries. All Canadians are with you. J'aimerais commencer par réitérer au nom du gouvernement du Canada.
I would like to start by reiterating our sincerest condolences to the families and the close ones of Captain Casey, member of the Snowbirds from the Royal Canadian Armed Forces. Our thoughts and prayers also go out to Captain McDougall, and we wish him health.
Having an input from Dr. Tam, who is Chief Public Health Officer of Public Health Canada, Dr. New, qui est l'administrateur en chef.
Dr. New, who is the Assistant Medical Chief Officer in Chief.
Minister of Small Business, Export Promotion and International Trade, as well as Minister Anand, who is from Minister of the Department of Public Services and Procurement Canada. Dr. Tam.
Hello everyone, good afternoon and bonjour à toutes et à tous. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 78,499 cases, including 5,857 deaths, with 39,498 cases, or 50%, now recovered. Labs across Canada have tested over 1,337,000 people for COVID-19 to date, with about 5% of these testing positive overall. We are now testing an average of 26,000 to 28,000 people daily, and these numbers change quickly and are updated regularly on canada.ca/coronavirus. Before I begin, I also want to offer my sincere condolences to the Canadian Forces Snowbirds team, who tragically lost one of his members, while another was seriously injured in an accident this past weekend, as they toured across Canada to lift our spirits in the face of COVID-19. We now turn our thoughts towards them with sympathy and shared sorrow. My reflection this past weekend was on the strength of unity among Canadians. Thinking about how much we've all been through this winter, I'm heartened by the resilience of Canadians as a collective. This is not to minimize what we've been through or the difficult path that still lies ahead. It is just a feeling of confidence that we've got what it takes because of the ingenuity, unity, and caring that I have witnessed. We've all been waiting to get outdoors and enjoy a bit of warmer weather, and I hope this past weekend was a chance to do that. I know it is a bittersweet opening up of our outdoor socializing spaces because we still need to practice restraint. Some areas where COVID-19 is still active need to be extra cautious, but everywhere we still have to maintain the basics of physical distancing and limiting our socializing to core bubble of contacts. The truth is, even with slow growth of the epidemic, we are not out of the woods. No country is. We know there is no certain path away from COVID-19 and that the only safe route is the one we take together, with cautious and calculated steps forward. This will be a summer of more restrained movements and virtual celebrations than we're used to. But to keep the curve down, we've got to keep our public health practices up. That is the only real certainty, and that is why we've got to go hang on to this safety rope and not let go. Throughout, I have seen the sacrifices Canadians have made to protect our health system and prevent even more illnesses and tragedy from befalling us. But it is the way Canadians have done this, with collective generosity, kindness, and ingenuity, that assures me we will give what it takes and get through this together. Thank you. Merci.
Thank you, Dr. Tan. Dr. New?
Merci. Bonjour. Comme d'habitude.
Thank you. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 78,499 confirmed cases, including 5,857 deaths and 39,498 people who are now recovered, which represents 50% of the people. Labs across Canada have tested over 1,377,000 people for COVID-19 to date, with about 5% of these testing positive overall. we are now testing an average of 26 to 28,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. Before I begin, I want to offer my sincere condolences to the Canadian Forces Snowbirds team, who tragically lost one of their members while another was seriously injured in an accident this past weekend. As they toured across Canada to lift our spirits in the face of COVID-19, we now turn our thoughts toward them with sympathy and shared sorrow. My reflection this past weekend was on the strength of unity among Canadians. Thinking about how much we've all been through this winter, Dr. Tam and I are heartened by the resilience of Canadians as a collective. This is not to minimize what we've been through or the difficult path that still lies ahead. It is just a feeling of confidence that we've got what it takes because of the ingenuity, unity, and caring that we have witnessed. We've all been waiting to get outdoors and enjoy a bit warmer weather, and I hope this past weekend was a chance to do that. I know it is a bittersweet opening up of our outdoor socializing spaces because we still need to practice restraint. Some areas where COVID-19 is still active need to be extra cautious, but everywhere we still have to maintain the basics of physical distancing and limiting our socializing to a core bubble of contacts. The truth is, even with slowed growth of the epidemic, we are not out of the woods. No country is. We know there is no certain path away from COVID-19, and that the only safe route is the one we take together, with cautious and calculated steps forward. This will be a summer of more restrained movements and virtual celebrations than we're used to. But to keep the curve down, we've got to keep our public health practices up. That is the only real certainty, and that's why we've got to hang on to this safety rope and not let go. Throughout, I have seen the sacrifices Canadians have made to protect our health system and prevent even more illness and tragedy from befalling us. But it is the way Canadians have done this, with collective generosity, kindness, and ingenuity, that assures me we will give what it takes and get through this together. Thank you. Thank you, Dr. New.
Turn to Minister Eng.
Thank you so much, Minister Duclos. Good morning. Bonjour tout le monde. I'm glad to be joining you by video conference today. This has been a very difficult few months for Canadian small business owners. To them, I want to say we're here for you and we're working hard every day to support you. Each day, from Vernon, BC to Grand Prairie, Alberta, Winnipeg to Whitby, Rimouski, Quebec to Miramichi and Halifax, small business owners, entrepreneurs, mom and pop shops, family-owned businesses have been talking to me and my team on the phone and on video conferences. Vous m'avez parlé de ce qui a fonctionné.
You told me about what worked and what hasn't worked. What needs to be done and what can be improved.
We have made our programs more generous, more flexible, and more inclusive. And thank you to all of you for what you've told us. Today, once again, we are responding to the very real needs of small businesses and entrepreneurs in our country. Weeks ago, we introduced the Canada Emergency Business Account, or CEBA. It's an interest-free loan of $40,000 with up to $10,000 forgivable if you pay it back before the end of 2022. And this is available through your financial institution, whether it's a bank or credit union. To date, over 600,000 small businesses in every corner of our country are accessing this loan. But we've heard from sole proprietors and from businesses without payroll across the country that they've been left out. Aujourd'hui, nous élargissons donc le compte d'urgence.
Today we are expanding the wage subsidy.
Loan will be now available to sole proprietors and businesses that rely on contractors, as well as family-owned corporations that pay employees through dividends rather than through payroll. So if you're a business owner with a minimum of $20,000, if you're a business owner without a minimum of $20,000 payroll, if you have filed a 2018 or 19 tax return, if you have non-deferrable expenses between $40,000 and $1.5 million, such as rent, utilities, insurance, and salaries expenses, and if you have a business operating account at your local bank or credit union. While this expansion will help thousands more businesses to access this support, we know that there are still some business owners who operate out of their personal bank account as opposed to a business account, or they are new, or they have yet to file a tax return. We're working hard to develop solutions to help these businesses through this challenging time. Our work is far from done, and we will have more to say about that soon. Nous avons dit dès le début que dans
We said from the very start that this is an unprecedented situation. We are a government that listens and adapts.
business owners, we're going to continue to listen to you. We're going to continue to respond to your needs. And I want you to know that we will continue to have your back. Merci beaucoup. Thank you.
Thank you, Minister. And Minister Anand?
Thank you, Jean-Yves. Today, like everyone in our country, my thoughts are with the family and friends of Captain Jennifer Casey, as well as those in Nova Scotia. We together mourn an incredible person and a terrible loss. I thank all members of our armed forces for the tremendous work that they do every day, from serving in conflict zones to helping our seniors, to lifting the spirits of communities across this country during this crisis. You put duty and country ahead of self every day. Our country is grateful to you and proud of you. I turn now to our procurement update. Pendant que les Canadiens
While Canadians are doing all that they can to limit the spread of COVID-19, we are continuing to work hard to purchase the equipment and the provisions that Canada needs in order to face this pandemic.
as Canadians return to work, with parts of the economy beginning to restart, our strategy remains constant: to continue buying proactively in a highly competitive market. As I have said in the beginning, it is impossible to eliminate all risk when securing equipment quickly in a fiercely competitive global environment. But we are taking no chances to ensure the safety and effectiveness of the equipment before it is sent to provinces and territories for use by frontline healthcare workers. Malgré les défis qui posent des chaînes
Regardless of the challenges created by complex international supply chains, we are making progress.
34 plane loads of PPE arrive in Canada. In the past week alone, at 4.8 million, we have almost doubled the number of face shields delivered. At 69.5 million, we more than doubled the number of surgical masks delivered, and we brought in more than 15,000 liters of hand sanitizer, with the total at 87,000 liters. Nous avons également reçu une commande importante.
We also received a significant order of 203 Zoll ventilator respirators, more.
Taking our foot off the gas pedal. We have orders for hundreds of millions of further PPE and other medical supplies, including 500,000 3M N95 masks total for this month, with shipments arriving weekly across the Canada-US border. This is in addition to a larger volume of masks that 3M regularly provides to provincial and territorial health authorities directly. As I will discuss shortly, at the same time, Canadian companies are continuing to ramp up production. Nous présentons des mises à jour hebdomadaires.
Weekly updates on our progress can be found on our website.
Numbers of procured PPE fluctuate at times, as orders or contracts may be canceled or amended in response to global pressures. Given the current environment in which we are operating, this is expected, and it is why we continue to diversify our supply chains and to buy aggressively. Notwithstanding fluctuations, the trend lines are moving in the right directions. At the same time, domestic production continues to increase. My colleague, Minister Baines, and I are ensuring that our domestic capabilities continue to ramp up through our government's plan to mobilize industry to fight COVID-19. Made in Canada face shields, components for testing, and ventilators are starting to arrive, and quantities will increase over time. Companies such as Medicom will be producing N95 and surgical masks right here at home in the next months and years. As the Prime Minister just announced, we have signed a contract with Samuelson out of Montreal, with deliveries starting at the end of the month. This contract is in addition to gowns being produced in Canada by Stanfields, Canada Goose, and Logistic Unicorn. Comme la pandémie entame une nouvelle phase,
This pandemic is moving to the next phase that is marked by gradual de-isolation, and we know that PPE is going to be in high demand. It is important to have an active and solid collaboration with provinces and territories and inside the government. We are going to need to have a strong capacity to innovate and to learn from our best practices. Our Council on Supply related to COVID-19 will play an important role and will give advice on the purchase of goods and services, essential goods and services in the future.
is going up, and we are keeping up. Health workers have enough on which to focus without having to worry about the equipment they use. That is why our government is buying in bulk and has implemented many levels of quality assurance. I want to assure healthcare professionals that they can have confidence in the PPE coming out of federal warehouses to be distributed by provinces and territories. Merci beaucoup. Thank you so much.
Merci beaucoup, chers collègues. Donc, des nouvelles.
Thank you, colleagues, for this important news from the Prime Minister, increasing the eligibility for the Canada Emergency Business Account. 6,000 companies are already benefiting from this program. Also regarding medical equipment supply, and an announcement regarding a 30-day extension regarding the border measures with the Americans. And we will now be pleased to answer your questions. Thank you, Minister.
With 3 questions on the phone and then turn to the room. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. La prochaine question est de Hélène Buzetti de Le Devoir. La parole est à vous. Oui, bon.
Question from Le Devoir. I don't know if one of you might be able to guards the operations of Parliament. Will it continue to sit? Because many sitting weeks were missed, I was wondering if it might be possible for you to sit through the summer. Answer by Minister Duclos. As you stated, we are going through an unprecedented situation. As you know, we focused our attention on managing this sanitary crisis, but we also have to work with opposition parties in order to focus on other issues, and that is why we are continuing to discuss with the different party leaders. Follow-up question. So, this is not something that we've thought of. I have a question for Minister Anand regarding ventilators. We seem to want to purchase more of them, but as far as I know, there aren't any provinces that have stated that they have a lack of ventilators. Is there truly demand for that? Answer by Minister Anand. Thank you for your question. It is important to have a short-term and a long-term plan. We don't know what's going to happen with this COVID-19 pandemic. And so we're put in place plans for the weeks and months to come, as well as for the year. It's important to have the equipment that Canadians need now and in the future.
Operator, next question, please.
Thank you. The next question is from Laura Osmond from the Canadian Press. Please go ahead. Your line is now open.
Good morning. For Minister Anand, I wanted to ask you about domestic companies retooling for medical supplies. As the economies are reopening and they want to be getting back to their usual business, how long do you foresee them continuing to make these supplies? And should it be something that we consider in the very long term, having more domestic production of these kinds of things?
It's a very good question. In French, I'll say the similar thing in English, that we don't know how the pandemic is going to affect regions throughout this country in the short and the long term. We also believe that it is important that healthcare frontline professionals have the equipment they need now and in the months and years to come. And so our approach in terms of contracting, both domestically and internationally, is to ensure that we have a steady supply of goods coming into Canada. We've had 34 flights coming in from China recently. But you ask about domestic production, and it is there that it is so incredibly important to focus on, because we want to make sure that Canadians' stores of personal protective equipment and other supplies will be available in the short and the long term. And that's why we have contracts in place to ensure a steady stream of these supplies over the short and the long term. This applies not only to surgical masks, but also to N95 masks. We have a company in Montreal called Medicom that will be producing both types of masks in the coming weeks and months. And in addition, gowns and face shields are also other types of equipment. Hand sanitizer also very important for us to have these supplies on hand ready to serve Canadians as we move through the next phases of this pandemic.
Follow up, Laura?
Thank you. And for Dr. Tam, I wanted to ask you, what does it tell us, if anything, that 50% of confirmed cases have now recovered?
Yes, so obviously we would want to see the number of active cases, what we call active cases, that those who have not recovered to come down and those who have recovered to go up. And sometimes it can take a bit of time for people to recover as well. And so that's tracked for that purpose. Of course, it's also important for planning purposes, and it indicates whether the health system is still able to cope. So the number of recovered and therefore the number of active cases are important from that respect. But basically, all of the indicators that we're tracking all continue to show that the epidemic, this first wave is slowing down across the country, but at a different pace, of course, depending on where you are.
Thank you, Doctor. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. La prochaine question est de Lina Dib de la presse canadienne. La parole est à vous.
Question from the Canadian Press.
You just said, you say you see that the epidemic is slowing down, but not at the same pace everywhere. Now that almost everywhere is either reopening right now or planning on reopening in a few days, what data are you going to be looking at specifically? Like, what's the first sign that maybe this is not going well and we should be shutting down again?
So At the Special Advisory Committee, which consists of all the Chief Medical Officers of Health, we've actually put out the criteria for reopening together with some indicators. So one of the first criteria is, of course, that you have control the actual epidemic transmission. And with that, you look at the number of cases, both linked and unlinked to outbreaks. That's important because you want to see if there are any cases that are suggest that there's community transmission, for which further investigation needs to be done. Obviously, testing and contact tracing is very important to support the tracking of these indicators. And you want to see, of course, case counts, but also hospitalizations, ICU rates, and deaths going down. We have been tracking other indicators. Some of them are more useful than others as the epidemic wave progresses. We talked about this effective reproduction number, and that is how many people a specific case would transmit to. For some jurisdictions, this is no longer a very good indicator because they have such low numbers of cases. But for others, we know overall in Canada, that is tracking just below 1. That is one of the ways that we're also tracking this, but depending on where you're at, that indicator may or may not be useful as well. And so we're tracking the disease indicators in conjunction with, of course, indicators showing that hospitals still have capacity to cope. We're tracking, we're sort of making sure that, provinces primarily making sure that people have plans when they're reopening and that workplaces are supported to do reopening safely. So, and also that we continue to keep importation of cases low. So these indicators are sort of already established as part of the foundations for a national approach, recognizing though then there will be regional differences in the timing and how they implement this very cautious reopening.
Okay. Merci. Et Monsieur Duclos?
Thank you. Question for Monsieur Duclos. Why did you increase the eligibility for this $40,000 loan program? Is it because not enough people had access to it? Why did you increase the eligibility? Answer by Minister Duclos. 2 answers. Firstly, as a lot of other programs, this program was put in place very quickly. It was quite effective because over 600,000 small businesses were able to have quick access to this emergency loan. I would like to highlight that small businesses in Quebec are very important to restarting the economy once we are able to do so. Secondly, we noted that with these small businesses, there was a lot of diversity. There were small businesses that were still unable to have access to this $40,000 emergency loan. And thanks to the leadership of the government, but also thanks to the business community throughout the country, we were able to find a way to increase access to small businesses to this emergency account. The goal is to make sure that our small businesses that were important before the crisis, but that will be even more important after the crisis, we want them to be able to help us to restart the economy, and that's why we needed to increase accessibility to this business account. Perhaps Minister Ng might have something to add to what I've already said.
Absolutely correct. I don't have a lot more to add other than that we have been listening to businesses right from the very would support them through this very difficult time. And we want to ensure that we are helping our businesses manage and to help them with, the operating costs that they do bear, whether it is utilities or insurance or paying that additional 25% top up, which I know many businesses do. And over 600,000 businesses have already taken advantage of the loan, and it's those expenses that they are using this operating funds for to help them weather through this period.
Thank you, Minister. We'll now turn to the room, starting with Kevin Gallagher from CTV.
My question is for Dr. Tam. Can you let us, give us an idea about what the public health arguments or concerns are for keeping the Canadian-U.S. border closed to non-essential travel? What are the benchmarks that public health officials will be looking at when and if that sort of regular travel between Canada and the United States starts to commence?
Yes, so again, that is quite a broad discussion, but at the Special Advisory Committee, as I said, we looked at some of the criteria for lifting some of the restrictive public health measures. One of the sort of consensus approach at the moment is that we have to cautiously lift measures within our borders first, just to see, because we want to see that the cases are still suppressed. You're still going to manage, detect, and clamp down on any new sparks that might come up. That's on public health capacity, healthcare system capacity, protecting the vulnerable, and etc. But part of this equation is if you the international border and the measures that we've put down at the moment, particularly the massive reduction in the number of international travelers, has allowed Canada to manage this first wave of the pandemic. If there is increased volumes, we want to make sure that we have the safety of Canadians at the top of our minds. So we want to make sure we not only keep up, but maybe strengthen some of those measures. The mandatory 14-day quarantining of people who come in remains a cornerstone as we go forwards. And the fact that we have to be able to manage that and ensure that people are following that requirement, and especially if volumes do go up. So some of these are the key considerations. Of course, there are other considerations by other areas of the government that wants to make sure we still get the supplies and everything that we need. There are social and economic impacts that can impact negatively the health of Canadians as well. So we need to also balance that. But fundamentally, it's about ensuring that whatever we do, the system is still able to detect and still able to cope with any introduction.
And just a follow-up, actually on the World Health Organization, Dr. Tam, we've heard from President Donald Trump that he wants to, threatening to pull American funding from the UN agency, maybe even rescinding the membership of the United States. And it comes at a time, whether you agree with the President's opinion or not, of increased criticism against the World Health Organization for its handling of the outbreak. Is there, are you at all concerned or have any ideas about what the credibility or long-term credibility of the World Health Organization, could look like as this pandemic continues to unfold, as we see that there's pressure for an independent investigation to how the WHO handled the beginning of this coronavirus outbreak?
Well, I think, as everyone can fully appreciate, this is a completely unprecedented pandemic, which in the modern era, people have not seen. So I think every organization will have lessons learned. There is absolutely no doubt. And I think from a Canada perspective, and which I think has been made clear in many weeks, that one, now is the time for global collaboration, because we just talked about international borders. And Canada cannot resume some of those activities without other countries also collaborating together to reduce the transmission of the virus. So the WHO actually plays a really critical role in that, because every country now has some sort of measure. And there needs to be I think now more than ever, there needs to be international collaboration, and the WHO is critical in that. But I think Canada is also supporting the call for the independent assessment of the response, not just the WHO, which is the secretariat to the World Health Organization, and the Assembly is the member states as well. So you can't sort of just review in just the WHO response, but how we all intersected with it and how each member state is able to respond to it. And so I think that is the prudent thing to go to do. And I think the resolution at the World Health Assembly just now is looking at this independent assessment at an appropriate time. Because right now, of course, everybody is in the middle of response. And this period where countries, not just Canada, many are beginning to lift those measures, is a really delicate time where I think that massive international collaboration has to occur. So I think, Canada supported that resolution, and we will move forwards. I think the other thing is that, I think the WHO is what we member states make it. We can make it stronger and better as part of our international response to future pandemics. But there's no doubt that all of us have something to learn.
Thank you, Doctor. Julie, over to you.
Julie Van Dusen, CBC News. For Minister Anand, in anticipation of a vaccine being developed, I'm wondering, is there anything that you are doing now to get ready, perhaps talking to domestic interests, such like a vaccine can be manufactured here? Are you purchasing supplies related to vaccines in advance, syringes and other things?
It's a really good question. Obviously, as I just said, we are preparing for the short and the long term. And the key point in the long term preparation is to make sure that Canada is positioned well in terms of procuring and manufacturing vaccines. So by all means, we are planning for that. We are ensuring that Canada would have the additional supplies that you mentioned to ensure that we can move forward with vaccinations when the time is right. No question about it.
Okay, and perhaps the border, obviously there's health concerns. Are they worried about our infection rate, or are we worried about their infection rate, and what has to change for the border to open?
So, as I just said, every country is sort of dependent on all other countries, if you actually think about it, and every country has a role in reducing viral transmission within its own borders. So, of course, we will be watching what is happening in the United States in terms of their epidemic and their trajectory. And as I am certain that they will be looking at the Canadian epidemiology as well. So I think that does form part of the consideration in protecting each other's citizens and sort of collaborating on that. But then looking at, well, how can we then safely resume some of the activities? And as I've said, one of the key aspects of that is that anyone who's entering, if they undergo that quarantine period, you can reduce the potential risk of importation. So all of that, I think, comes into play. But the considerations for that international border is much more complex, I think, than just the sort of technical health input. So I'm sure that leaders will be discussing all those other complex aspects to that.
Thank you, Doctor. Mike?
Hello, Dr. Tam. Mike, I have to ask about President Trump has said on the weekend that he's taking hydrochloroquine, and do you have any thoughts on that?
Well, I think my message is still much the same as what I've said before, which is, we're all wanting to look at viable treatments. Everybody wants an answer and solution. But I think that right now, a lot of the studies are very preliminary on different treatments, and the results have been mixed. However, there's some preliminary evidence from studies outside of Canada suggesting that hydroxychloroquine might have some role or may be effective in reducing some viral load. So our recommendation is that if hydroxychloroquine is being used, it should be part of a clinical trial, for which there are already clinical trials in progress with hydroxychloroquine as arms of those treatment trials. Some of them are essentially being funded by the CIHR and the Canadian treatment for coronavirus, that the network that's being supported feeds into the solidarity trial of the WHO as well. And one arm is on hydroxychloroquine. I think it was just very recently, I can't remember which date, also Health Canada approved a trial for the use of hydroxychloroquine in hospitalized children. And that is very important as well, because different age groups can have different responses to hydroxychloroquine. So really the bottom line is that the medication must first of all be preserved for its current indicated medical treatment, for example, for people with lupus, for malaria, prophylaxis or treatment. And then we need to then have hydroxychloroquine go into clinical trials.
Okay, and so we don't have any evidence as of yet that it's having an effect. And more importantly, what are the dangers of taking a drug that has not been fully tested?
Well, I think any drug has side effects, of course. And so that's part of the study in the clinical trials. And some of it might occur, the trials might start with healthy people first, but you want to see how these drugs also perform in people maybe with, at different age groups, but with underlying medical conditions. And there are drug-drug interactions as well. So I think every treatment has its risk and benefits, and that's why you need those trials.
Thank you, Doctor. We're now going to go back to the phone. Operator.
Thank you. Merci. La prochaine question est de Michel Lamarche, TVA. La parole est à vous.
Michel Lamarche for TVA. Question, either for Dr. Tam or Dr. New. This morning, the Prime Minister talked about national guidelines regarding tests and contact tracing. Could you give us a little bit more information? Because de-isolation has started in certain provinces. What is it going to look like? What do you expect? What should happen? Answer by Dr. New. Thank you for your question. Dr. Tam and I are members on the Special Advisory Committee with our provincial and territorial colleagues. We talked about conditions for de-isolation because things will be different in the different regions throughout the country. They all have their own epidemic curve. If provinces and territories start reopening things slowly, we need to make sure that we have the capacity to test possible cases. The federal government is always ready to support provinces and territories and their approaches in order to do contact tracing. If there are cases, new cases in provinces and territories, we need to make sure that we have the capacity to test these cases, but we also need to make sure that we are able to do contact tracing. We are always ready. We have people who are trained to help provinces and territories to do any necessary follow-up. Follow-up question by Madame Lamarche. That's not my question. This morning, the Prime Minister wasn't talking about guidelines for de-isolation. He was talking about guidelines for tests and contact tracing. So, tracing people who were infected, what does this mean? What are these directives? Do you have a specific number for tests? Do you have any specific measures for contact tracing? That's what I don't understand. Answer by Mr. New. Regarding contact tracing, it's not necessary to have guidelines because the way we do contact tracing is already very well established. We have to do interviews and ask questions, ask people who they came into contact with, close contact with, and do interviews with all the other people contacted. Now for guidelines on testing, this is something that we talked about with our provincial and territorial counterparts. We decided to highlight criteria for testing. It's not necessarily something that we publish on the internet, but Dr. Tam and I worked with our counterparts to establish criteria. I won't be able to give you too many details because it'll take a lot of time, but the priority is to test symptomatic people. And things might evolve because at the beginning of the pandemic, even here in Canada, we thought that it might be a person with a cough, a little bit of difficulty breathing, but now we know that there's a wide array of symptoms. So with these guidelines, we'd like to have tools and flexibility for clinicians and doctors in order to be able to do testing for people with any of the symptoms. And we already have a long list of symptoms. So that's one thing. We also talked about scientific evidence regarding people who are asymptomatic. For example, if there's a case in a long-term care facility, it might be a good opportunity to do a more significant level of testing and test residents in that long-term care facility. So that's a bit about the guidelines. I think that these guidelines will be published soon because we've already decided on them, but it takes a bit of time before we can put all that on the internet. But also, I know it can be a little controversial, but we had to reflect on what we do to screen populations and asymptomatic populations. We discussed if we had a case in a long-term care facility, it would be a good opportunity to screen residents and staff. But if we talk about then on a more regional level, the evidence shows that it might not be the best use of our resources because we're increasing the risk of having more false positives. We might have false negatives. Perhaps our screening results won't be as good if we continue screening people who are asymptomatic. This is something that we are currently discussing with our counterparts. Thank you, Dr. New. Next question from the operator, please.
Next question is from Lauren Gardner, Politico. Please go ahead. Your line is now open.
Hi, thanks. This is kind of asked about earlier, but I kind of wanted to pose it to the ministers with respect to reopening the border. Can you elaborate a bit more on what exactly you're going to be looking for, especially from the U.S. side, when you're thinking about things like when can non-essential travel restart, how gradually might a reopening take place?
Well, if I may start, we'll be focusing on the health and safety of Canadians first and foremost. That's our obligation as a government. Obviously, we'll be relying as well on the advice of public health officials. We have the tremendous advantage in Canada of having public health officials of world class, and therefore they will be helping provide guidance both from an internal public health perspective and from information and intelligence in the South, of course. And that's based on that guidance that we'll be making those sorts of decisions and making those sorts of negotiations with our American friend.
Laura, follow up?
Also, I'm just curious, if cases continue to trend downward, do you foresee a blanket extending through the summer, or do you think that by June there's going to have to be some kind of loosening happening should the COVID trajectory continue to slope downward?
Well, again, these are very important questions. However, they are hypothetical scenarios of which we have very little evidence now. So, as I said briefly earlier, and we would like to say more. Unfortunately, we are very focused on current evidence, epidemiological evidence, both north and south of the frontier, and that's why we were able to come to that agreement with the United States that we would extend the agreement by at least 30 days, and we'll see in the next weeks how we manage the future.
Thank you, Minister. Operator, last question, please.
Thank you. Merci. La question est de Louis Samuel Perron de La Presse. La parole est à vous.
Question from La Presse. My colleagues asked the question in English regarding the border with the Americans. Mr. Duclos and Mr. New, I would like to hear you talk in French about the scientific and economic conditions that would allow us to reopen the border. Answer by Minister Duclos. We have a solid relationship with the United States. It was solid before the epidemic, and it continues to be very solid, and that's why we were able to prolong or extend the border closures. Regarding scientific evidence now, we have experts in the field that are well next to their advice, and thanks to our good ties with the United States, that we will continue to discuss the right way to meet our most important goal, which is to ensure the health and safety of Canadians. If we can assure the health and safety of Canadians, then we will be able to focus on trade between both countries. Louis Samuel, follow-up question. On another theme, for Air Canada, for example, and other companies that are refusing to refund plane tickets, will your government force these air companies to reimburse regarding refunds of flight fees? We understand that it is frustrating for Canadians who bought a plane ticket who are not receiving a refund. That said, we're living through extreme circumstances, and we are counting on these companies to do what they can to respect the laws and to serve their clients, because they need to have good relationships with their customers if they would like to restart their activities. And we have assistance programs for small and big companies. For example, the wage subsidy. There's the program that helps large companies like Air Canada. And we hope that these large businesses will distance to maintain their operations and also to help their customers. Thank you, Mr. Minister. That concludes today's press conference. Thank you.